Breast implant is a very commonly performed procedure these days to improve the breast contours. Well, there are two types of implants from which you can choose from. One is the silicone implant and the other is the saline implants. Hi everyone, I am Dr. Anshu Mishra. I am a board certified cosmetic and plastic surgeon practicing in Dubai, and today in this video I'll be discussing few differences between the silicone and the saline implants. What is the basic difference between the saline and the silicone implants? Saline implants have an outer silicone shell and they are empty when they are inserted in the breast. Later, after insertion, the sterile salt water, that is saline, is then injected to give an appropriate size to the breast. Whereas silicone implants have an outer silicone shell and they have a cohesive silicone gel inside. So if we compare the difference between the two on the basis of the feel and the look, then silicone implants, they look more like a natural breast tissue. The feel is soft as they have a cohesive gel inside. Whereas the saline implants, they give a firmer and a rounder look, and they are slightly firm to touch because they have saline inside. Silicone implants over a period of time will mimic the natural shape of a breast tissue as the cohesive gel inside is going to gravitate. What happens when the implants rupture? Nowadays, the implants which are being used are high quality, they are durable and are resistant to rupture, but it is still one of the common risks which is associated with the breast implant. So when the saline implant ruptures, the water inside the saline implant is absorbed by the body and the breast will feel empty and deflated. Whereas when the silicone implants rupture, it's a silent rupture and it is not very easy to detect it until and unless there is a sudden change in the shape of the breast or there is a marked asymmetry. Sometimes the rupture of the silicone implant may be associated with the capsular contracture. So when the silicone implant ruptures, either it can be an intracapsular rupture or an extracapsular rupture, the silicone will interact with the surrounding breast tissue, leading to some inflammatory changes. In both the conditions, either the rupture is associated with the saline implant or the silicone implant, the surgery or a revision surgery is required wherein the implants are removed. Which implants last longer? Both the silicone and saline implants have been designed in a manner that they are durable, but both of them needs to be changed after 10 to 15 years of their primary breast augmentation surgery. It has been proven that saline and silicone implants are same on this aspect. If we compare the cost between the saline and the silicone implants, then silicone implants are slightly more expensive than the saline implants. So I have tried to cover some basic differences between the two types of implants which are available. If you have more questions, feel free to write in to us. I will be happy to answer. To see other cosmetic surgery related videos, you can subscribe to our YouTube channel. I am also available in other platforms like Instagram and Facebook. Thank you.